What's up, fellow classmate? My name is Caleb Toyo. I'm a current senior here at Western Washington University. My pronouns are he, him, and his, and my major is Arts Studio BA, which is Bachelor of Arts, Communication Studies, and my minor is ACI, which stands for Arts Enterprise and Cultural Innovation Program. Now, today, I'm here to ask you the question if you agree or not that the United States should adopt a nationalized universal healthcare system. Now, personally, I think we need this right now at this point, because ever since Donald Trump became president last year, he's been hitting some left and right that were mostly just misses that have been causing chaos to not just our entire country, but the entire world, just berating, discomforting him, and just feeling irritated of his laws and regulations right now. For instance, like we've been dealing with the tariffs, which has been increasing the pricing right now. And, I know many family and friends right now that are dealing with a lot of stress and being overwhelmed by can't even afford buying food from grocery outlets and markets. Can't even pay the housing bills right now for the next few months. I even know people who are in hospitals right now that can't even pay for the health insurance or like for the medical treatment in the next few days, and then they've just been getting delayed right away, or even postponing or rescheduling, and it's totally unfair to people who need it right away than people who are just a little injured and like can't take care of themselves. Now, hear me out. I believe that as long as the United States can cooperate with many countries that are also in need of the situation, if we can come to a cohesive unit and having all citizens and people internationally to work together, I believe that having a medical coverage can help be critical to our living productive, having security, and having the well-being of staying healthy towards the variety of these situations, whether it's private or public sources such as Medicare, medical aid, and of course my personal favorite, the Veterans Affairs programs. Now, these rules and regulations are set forth by lawmakers on a local, state, and national level on preventing global issues such as preventing smoking, infectious diseases such as polio and measles, and then climate change as well, which is a big issue as of right now, and also providing sustainable hospital communities around the world. However, there seems to be a little blockade party. Well, the United States has not reached the aiming target by achieving um the universal healthcare for all countries by the end of 2030. We have 5 more years to get there if we want to get approved by the United States and have other um governments and other communities to agree upon the situation. Now, even though people might agree that the United States is the wealthiest place around the globe, such as we have Elon Musk, Jeff Bezos, even Kendrick Lamar, and Gordon Ramsay, it doesn't mean that millions of citizens will remain provident of their health insurance. That's why I believe that the United States should to have the desire to obtain a universal healthcare system and and ensure that everyone will have affordable services no matter the financial situation. Now, here are two positions of what I believe can help with the situation. Number one is the growing positive economy. According to a brochure PDF document called The United States Should Have a Universal Healthcare by Ian Anderson, a student nurse from Misericordia University, he provides saying that providing equalities by being healthier will help people will miss the days of work due to illness and function at the highest level because their health is what allows them to keep functioning. And these practice applications can help professional healthcare workers to promote better workplace distributions and reduce expensive hospitalizations. This also leads up that with these employers and these job workers that they can be more efficient and guaranteed having an increased job with that bundle package of having health insurance, especially with employers who are women or pregnant or have maternity leaves, since these female workers get easily discriminated by being widowed, part-time, salary, or of course the inequality. Now the second option would be the expense services in response to demographic and epidemiological changes. This means that having the healthcare insurance could have saved millions of lives. Back in 2019 when COVID-19 was announced, even though it was circulation around between 2014 to 2017, that according to the SI Appendix Table S1 from the PMC, which is the PubMed Center, they discussed that they calculated an estimation that we could have saved 68,000 lives back in 2017 during that legislation law. And plus now with the combination of deaths and years, it became a attributable and zero benefit, which means we only lost 77,675 excessive deaths without any medical coverage or repercussions. It just proves that organizing and addressing medical, public health, and communities around everywhere will ensure diseases and continuously monitor to deploy appropriate interventions. In this case, health is an investment, not an expense. And it can be both a external and domestic financially support that can be a sweeping change as a primary healthcare approach and tackle workforce shortages. Now, there are two rebuttals of why people might think it could be controversial. I believe one is that that people are ignoring the existing excess improvements and questionable morality claims. This means that healthcare costs among taxpayers are the encroachment of civil liberties and justify that the reducing of it as a collective burden. In this case, according to a research study by the Yale University, people saying that 235,000 lives could have been saved at the start of COVID pandemic. And then ever since March 2022, the US has become a universal single pay healthcare system now, which is not good. And within 2020 alone, there's been only about 212,000 deaths could have been avoided easily. In this case, this became a undermine for the government alone that the government can be achievable and getting enough health coverage at this point. Um, it might be unstable. It could be undermined towards human rights and gender equity, and on a broader national level, the equity human resources for service delivery and efficient financial allocations. It just proves that it's a poor probability and the entitlement to the UHSC, which is really bad because we should be a commitment to saving human rights and saving the population of humanization. And the last one I think would be is the Department of the Veterans Affairs is an example of the failed system. So unfortunately, and back in 2013 to 2014, there's been an article saying that the Department of Veterans Affairs Services that 150 hospitals and about 1,400 outpatient clinics were being misused. In cities like um, Phoenix and Arizona, based on the according post of the Washington Post, there's been a allegations by the VA inspector that there's been falsified records in those two specific cities that were being called out for inappropriate scheduling systematics, which was caused by human errors, delayed treatment, and even deaths at the time. As for which was caused by students, current veteran students, and also many other people. So in this case, I believe that we should be claiming that it's very incomprehensible. It's not an access to care at this point. So in my belief, I think that we number one, protection to against future outbreaks and preventable deaths. This proves that having UHSC can help establish quality of life and support longevity, and we can able to analyze these upcoming challenges along the way for more children to prevent being prone and illness and get health insurance. Thank you for listening to my speech.